Today is about us coming together as key partners in delivering mental health care services across our broad district area. And today is really about us focusing on our joint regional plan, and it's about bringing our key staff and key services together to have a conversation around what we do and how we can do it better.
So we started in 2020 with a joint regional plan, which was written by both of our organisations with Central Coast Local Health District. We're now coming towards the end of that 5-year plan, and we're looking at what we've done well, what we've achieved, what some of the barriers have been, what some of the enablers have been, and where we would like to move forward with the joint regional plan for the next 5 years.
The focus today is really around putting the consumer at the centre of what we do and our communities and how we can best meet their needs at a local level and then more broadly.
And we also know that we are stronger when we partner and we do things that are integrated and provide services that are holistic for people rather than doing things separately that people really need to go to search to find.
One of the key aims in terms of our strategic plan is to focus on how do we build up the partnerships and strengthen it so that we can address some of the longer term challenges we have. There are so many pieces of work which we are undertaking, which have improved services. But what we'd like to do at this stage is look at the long-term systemic challenges we have. And the only way we can do it is by collaborating, strengthening, identifying the gaps, and then trying to work on strategies jointly.
For me, it's bringing the providers into the conversation because they're the ones delivering the service. So I'd love to see, big meetings with the providers and hearing what gaps are in the community that the LHD can fill, because the goal is to provide a holistic program. So where can the LHD plug in to support that holistic program?
We think of our partnership as planning, but the PHN delivers a range of services to us, to the people in our community, that enhance our service delivery and mean that we get so much better care coordination for the people that we work with. So today, in working through the strategic plan, we can nut out what works in that, what needs to be enhanced or improved, and where we need to go. So it's been a fantastic opportunity to do just that, get to know each other, understand each other, and really understand the lenses through which we see and work.
The focus of the joint regional plan has been a number of key working groups. We've provided people with time and space to meet in their working groups and to work through those opportunities, their strengths, and how we can move the whole plan forward.
It's been really good to meet everybody here, and I think integration is such a crucial part of what we do. Really trying to think of the health system as one health system to improve the patient journey from primary care to allied health or to acute services and then back down again.
And it's nice to just have some time to chat in general and get to know each other a little bit more, find out who else in the LHD I might need to interact with, and I've already done that, which is exciting. I've written some names down. It's good to hear about what else is going on as well and see where I can provide support.
Brian and I both work in quite a important role in the community, so I think it's really important for us to be able to sit down together face to face, which we don't always get to do. But also some input from our other colleagues in both PHN and HNE.
Some of the work we're doing crosses over, but it's the same idea. So we obviously know through our community that it's translating through to the work we do today. So we know we're hitting the mark. So that's the exciting part of this.
The plan's been really helpful in terms of having a really kind of concrete reason to come together and think about how we work together. And so there will be parts that we both have primary responsibility for, but often there's areas where we have dual responsibility, or there's bits where we need to both be playing in the space well, or people fall through the cracks.
What role we actually both play, I think, has taken us some time and to work through, and what level do you come in and at what level do I come in? And so to come in on those activities and actually really tick a lot of them off, which we're really proud of, but then set the trajectory for what we want to do next, I think is great. And we've got, great collaborative.
So as we're coming towards the end of the joint regional planning process for the 2020 to 2025 period, we're looking at engaging a consultant to work with us to refresh the plan and to put forward a new plan for the next 5 years to really capitalise on the partnerships that we've started to create and the work that's starting to develop between the two organisations.
Which is really important with the strong focus on mental health in our community, in how do we support and connect with our consumers, but also to recognise that there's a broad spectrum of need from mental health right through to the management and support of those with severe mental illness. So really exciting times for us as we celebrate what we're doing well, but also to move forward into our next plan.